Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear 2 trainee doctors doing an activity at a staff training day. Now read the question.
So, what did the trainer say we have to do?
Well, we've got to look through these case notes, 10 sets in total, and decide which of the patients should be referred to the consultant as a matter of urgency and which can wait.
Oh, right. And did I hear him say there's a limited number you can refer?
Not exactly. He said that we should put them in rank order according to the severity of the symptoms and other factors evident from the case notes. Once we've agreed on our list, we have to go and compare with another pair of trainees.
Okay, let's get started then.
Question 26. You hear a radiographer talking to a patient about her MRI scan. Now read the question.
Come in. Mrs. Brown, isn't it? My name's Ted, and I'm going to be doing your MRI scan today. Now, can you get up on the table for me?
You know, I'm really claustrophobic.
Well, this is a new piece of equipment. The diameter is much larger, so it should make it a little more comfortable for you. You'll also have this call bell, so if you need me at any point during the test, you squeeze that, okay?
Okay.
Now, your scan's only going to take about 15 minutes. Are you okay with that?
I am.
Okay, let's get started then.
Question 27. You hear 2 nurses discussing an article in a nursing journal. Now read the question.
Did you see the article about research on strokes and sight problems in the latest nursing magazine?
Yes, I found it interesting that there's quite such a high degree of visual impairment after a stroke.
Yeah, but I think I could have told them that without an expensive research study.
Well, you need evidence to get progress in how people are treated, and now there'll be a push for all stroke patients to have eye assessments as a matter of course.
It certainly makes a pretty solid case for that, especially as there's plenty that can be done to help people if early screening diagnoses an issue.
Absolutely.
I was just sorry the article didn't provide more detail about the type of sight problems that are most common after a stroke.
Well, there's a reference to where the whole study's been published, so you could always find out there.
Question 28. You hear 2 hospital managers talking about a time management course for staff. Now read the question.
The uptake for the course in time management for staff has been disappointing, hasn't it?
It has, but I'm not exactly sure why, because everyone seems to know about it. And we asked for it to be changed from a 4-hour session to 2 2-hour slots to make it easier for nurses to be released from their wards. But apparently that wasn't possible because it has to be done a certain way.
Yeah, I'm not convinced that was the problem anyway. I think once staff become aware of what it's aiming to do and how it fits together with other initiatives, there might be more interest.
Yeah. There certainly is a need, even if the staff themselves don't actually realise it at present.
Question 29. You hear an optometrist reporting on some research he's been doing. Now read the question.
I specialise in dealing with fungal eye infections. At present, treatment involves giving eye drops every hour for at least 2 weeks. I wanted to improve this process by designing a system capable of releasing antifungal drugs onto the eye over an extended period. Contact lenses are perfect for this, as their hydrogel structure has the ability to uptake and release drugs, and their placement on the eye ensures the drug gets released directly to the cornea. In order to make a contact lens provide drugs over a sustained period, I've modified the lens. I've also used nanoparticles for packaging the drugs. So, I've managed to create a system capable of delivering an antifungal drug called nanomycin for up to 4 hours. I now hope to increase this and use this system with other drugs.
Question 30. You hear a consultant talking to a trainee about a patient's eye condition. Now read the question.
Have we got Mrs. Kent's notes?
Yes, they're here. She's coming in today for possible laser surgery for her retinopathy, isn't she?
Well, depending on results. And from the look of these pictures we took last time, there's been a slow improvement. So we'll talk to her, and perhaps hold off for the time being, unless her condition's worsened, because it can in some cases.
So what's the cause?
Well, we know a leak of fluid behind the retina causes the distorted vision which sufferers get, but not why that occurs. There may be a link with stress, and also steroid use, but the jury's still out, I'm afraid.
That is the end of Part B. Now look at Part C.